We've have a report that has been filed regarding warning that the fight against HIV/AIDS is at a critical turning point. While the world has made significant progress over the past decade, funding cuts now threaten to reverse many of those gains. A very good morning to you. Welcome to the program, Dr. Kgosi Letlape. A very worrying situation, is it not?
Good morning to you and good morning to the viewers. And I don't know whether you call them streamers as well.
Of course, we do.
This is an extremely worrying situation because when you look at the fact that 1.2 million new infections worldwide and maybe over 100,000 of them occurring in our own country, it's quite a staggering number. And the fact that we still have 500,000 people, 500,000 people dying from HIV, it's quite alarming. Now, the key issue is the fact that we have not been successful in making non-pharmaceutical prevention work. We've not been able to deal with the socioeconomic circumstances of women. We are not able to protect the vulnerable groups, young females, adolescents, and vulnerable groups like LGBTQI or people with disabilities. So we have a long, long way to go. And one of the challenges is we are not confronting the socioeconomic conditions of the people in our country. We're not dealing with the social construct. And frankly, we're not dismantling patriarchy in our society.
So, Dr. Kgosi, when we talk about this current situation, is it specific, when we look at the key findings of the report, is it specific to South Africa or to Africa and globally? What does the key findings actually tell us?
It is more telling for low middle income countries across the globe. Africa will probably bear the brunt of this, but you'd have the same challenges in South America, the same challenges in some Asian countries. Because part of the battle against HIV has been funded by international partners. Now the impact, the US was a major funder, not only in HIV treatment-related issues, but also in research. If I use South Africa as an example, we had funding that went to NGOs who were supporting people, the vulnerable groups that need treatment, who were creating safe spaces outside the public sector that was accessible to all people that could not afford, that are being stigmatized against. Now, once that funding went away, the government said, we're paying for the ARVs. But the management of HIV is more than just the provision of ARVs. It's also the psychosocial support that the people have. And we're not able to provide that in a public institution. So we are in a form of denial because the people at the top think this is just about pharmaceutical interventions. Management and bringing down HIV is more than just the issue of providing antiretrovirals and other pharmaceuticals. It's about creating a safe, comfortable space so that people can access those care centers without prejudice. Now, our public healthcare system is doing quite a lot, but it cannot be regarded as a safe space for vulnerable groups.
A short while ago, I did speak to someone else regarding government supplying ARVs in our communities, our most vulnerable communities. And the same issue has come up, exactly what you've said, is there aren't enough resources to support the psychosocial services and safe spaces to have people access this type of support. Are there perhaps, talks within government circles to start making those type of services available? Or is it really about funding as well? Is it about the costs involved in supplying the type of support that is lacking currently? And if that support is not forthcoming, how dire will the situation be?
I think the challenge we have is we should not underestimate what the government is doing and what the government has done in the past. When you look at the variety of illnesses that we encounter in the healthcare system, one of the best funded diseases is for people with HIV. It's better funded than cancer. It's better funded than other non-communicable diseases like hypertension. It's better funded than renal failure. So we should never underestimate the resources that government is putting in dealing with HIV. The problem is that the other aspects in society are not properly dealt with. The issue of supporting women to be able to say no, to be able to choose, to be able to ensure that they have dreams, they have futures, and they have hope for the future, that their future should not lie in being with a man. Their future should not be destroyed by older men. We are not dealing with those important aspects effectively to create a safe space for young women and adolescent children. So we have to understand that from the public spaces, we're really putting a lot of effort. What is not happening is dialogues in communities where we bring communities along, where we make communities understand that the issue of men being scavengers on women is a social problem, and society needs to stand up. The issue of families that have broken down, the issue of a values crisis in our society, it's not an issue that can be left to government. It's an issue of societies. So we need to come to a point in South Africa where all of us as citizens stand up and understand that we have a contribution. As a male in a family, you have a duty to educate young boys to be better men. You have a duty to educate young women to be able to take charge of their lives without fear and being supported by society. So we need to understand that we all have a critical role to play if we are going to win against this virus.
Okay, we've got to go for an ad break. I'm going to leave you with a question. Let me just ask my producer to bring that question up again. I'd like you to respond to that question after the ad break. Someone has asked, to what extent does GBV play a role in this spike, considering that underage girls are at risk coupled with teenage pregnancy? So you're going to respond to that and a whole host of other questions coming your way right after the ad break. Please stay with us.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
More than 800 million people around the world live in deep poverty, uncertain of where the next meal will come from. For those on the brink of starvation, a food pack means survival, dignity, and hope. Send food, send kindness. Be the reason a family does not go hungry. Donate now to Islamic Relief.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Are you banking with convenience, transparency, and flexibility? With Al Baraka Bank's transactional banking account, you can enjoy convenient everyday banking designed around your needs. Benefit from zero fees on point-of-sale transactions and manage your banking easily through Al Baraka's secure mobile banking app and internet banking platform. From everyday payments to managing your personal or business banking, Al Baraka makes banking simple, transparent, and convenient. Visit albaraka.co.za to learn more. Al Baraka, your partner bank. Al Baraka Bank Limited is an authorized financial services and credit provider.
Tonight, a child in a shack will try to sleep through the cold. No heating, no insulation, just thin walls and a biting cold. African Muslims Agency is on the ground, reaching families in informal settlements across South Africa with blankets and winter essentials. Help us spread warmth this winter. For 180 Rand, give a blanket. For 360 Rand, a full winter pack. One gift, one less night in the cold. Africa Muslims Agency. Empowering, educating, inspiring.
Rejuvenating media day by day. This is Salam Media.
It is 18 after 8 o'clock Central African time. News and views with me, Julie Ali on Salam Media. Our guest is Dr. Kgosi Letlape, health expert and, of course, Action SA member of Parliament. We're looking at a very serious issue, and that, of course, is the warning by UNAIDS that the HIV fight is unraveling as 1.2 million new infections are being recorded, and that number is growing as we speak. Welcome back, Dr. Kgosi, and would you like to respond to the question I put to you right before the ad break? And that, of course, comes from a viewer and a listener from our socials.
I think the main problem in our country is that the village has broken down. We have a values crisis. Society abdicates from its responsibilities. There's no consequence management for irresponsible behavior from males. The reason that we have too many child-headed households, too many children without fathers, is because society allows it. The fact that we have men that have multiple children with multiple women and take no responsibility and don't understand the concept of parenting is a problem. The fact that we have families that allow their young men to go around scavenging on young women. The fact that we have older men. I mean, there was a report last week that the Northern Cape has a crisis of older men impregnating young women, and they get away with it. And they seen as supporters of families that are in financial distress. Until we stand up and we take the issue of sex with a minor seriously and put the perpetrators in jail without bail, and that the charges, it doesn't become so-and-so versus so-and-so, it becomes the state versus that man. It should be like a murder charge where families can sweep it under the carpet. Families can come to agreements. The law must take its course. Until we get to that point, we will have massive teenage pregnancies. Until we go into our schools, give our children hope that they must understand that they are capable human beings and their lives should not be dependent on early childbearing, which destroys their lives. But we must create the opportunities for them. We must give them safe pathways for developing themselves and making their own decisions, and understanding that motherhood is not for teenagers. Motherhood, they should save it for later. But we need to ensure that there's consequences for irresponsible male behavior, and that families have to come to the party. Communities should have community values. We can't have a young man that has 6 babies all over the place and nothing happens to that young man. They don't even support those children. When I grew up, Julie, at university, I was at the University of Foreign. If a student got pregnant, and remember at university, these are adults, they're over 18. But if you got pregnant, you either got married or both of you got expelled. Now we have mollycoddling, where, oh, people are victims, oh, he's too young, or this and that. We've created good things where we support girls that are pregnant. We ensure that they continue their education, but they end up having 2, 3, 4, 5 more children and getting nowhere in their lives because other support systems are not there. There's no consequences for men. That
Would you say, Doctor, we really are stressing on the issue of teenage pregnancies. Would you say that that is the core issue regarding HIV and AIDS? And then also, I agree with you that we have moved away from the concept of it takes a village to raise a child. Why have we dropped such core integral values within our communities, which have always kept us together and kept us accountable for each other? Why have we moved away from that, and why are we embracing Western values? Something needs to change, and needs to change radically for us to embrace our integral Black values.
I think we also have to get away from playing victim and talking about why are we taking Western values. If you look at Western countries, they don't have the rate of teenage pregnancies that we have. They don't have the rate of HIV that we have. So we should take full responsibility about how our character has broken down and not blame it on others and try and recover those value systems. It's this notion where we want to blame everything on the past, we want to blame everything on apartheid. We have a beautiful constitution. But the one thing that I've learned is that we do it piecemeal. When you look at our constitution, it talks about rights. But the next sentence about rights go with responsibilities.
Mm-hmm.
Now, in this country, we have abandoned the issue of responsibility. You look at it elsewhere. I lost my daughter to femicide.
Oh, I'm
But
so
the
sorry to
system
hear that.
was then
So
about the rights of the perpetrator. So victims don't count in this country. And that's part of the problem, where we are not allowing people to take responsibility because we come from a period where we didn't have rights as a collective, but we acted responsibly to build our societies. Some of us come from times of apartheid times, but the community never lost its values because it was being oppressed. When you look at it now, we can't even keep our neighborhoods clean. We litter everywhere. That has nothing to do with Western powers. We've lost our character as people that were previously disadvantaged. And we need to get back that character where our lives matter to ourselves and our lives are not someone else's responsibility. And we should stop this nonsense of blaming the West for having lost our values. We've lost our sense of community. We've lost personal responsibility. We have a values crisis that has nothing to do with the West. It's got everything to do with the choices that we have made, where we misunderstand the issue of having individual rights. Does not mean you abandon being part of a community and respecting other people's rights.
Okay, I made reference to the West regarding the reference that I made to the West was how our young people want to emulate everything that is Western because it makes them feel relevant, current, and cool. But be that as it may, you also made a very important and a very distinct point there when you said the West doesn't have the high levels of HIV that our country is suffering, and teenage pregnancies. So despite the fact that I made a comment about the West, there's lots to learn from them as well. We're going to wrap up in a minute or two. So the all-important question then is, how do we move on from the issues that we started off talking: HIV, AIDS, the rising cases in our country, and the reasons for why we're seeing this. And you brought up very many issues. I also want to point out to something you said just now about look at our townships, look at our towns, look at our CBDs. It is absolutely unacceptable when you see the rot and the litter. We can't always blame government, can we? Okay, local councillors, local government may be dropping the ball, but we as responsible citizens should take pride in our surroundings. We should be proactive. Let's do something collectively or even individually. It will make a difference. But then coming back and wrapping up onto what we're talking about, and that is the rising prevalence of HIV and AIDS in our communities. How do we move forward knowing that funding has been cut? Where and how do we become active in making certain that the spread doesn't go further?
We have to understand that we need to take personal responsibility for our own circumstances. I don't know if you remember, they spoke about the amount of money we as South Africans spend on alcohol in December.
Shocking.
The amount we spend on alcohol could go a long way to bridging the funding gap.
Mm-hmm.
And the point that I'm trying to make is that we've got to take responsibility. We have become an irresponsible nation of individuals. We live in an internet age. We are the only society I know on earth where the celebrated, the leaders of society, endorse harmful behaviors. When you see every day, we have our sporting icons promoting gambling, and they are the poster children of gambling. We see them promoting alcohol. They are the poster children of alcohol. We have a serious values crisis, and no amount of external funding will save us until we look into ourselves in terms of the people that we have become. In a society that I grew up in, even if the municipality didn't collect litter, there would be rules in society that say nobody litters. And there would be a designated space where all of us put our rubbish collectively as a community. Now,
sorry to interrupt, that talks about civic pride or community pride, does it not? If we want to be living in clean spaces, it really talks about that.
Yes, it talks about that. It talks about we taking responsibility for our lives.
Mm-hmm.
We not becoming victims of the state of foreigners have taken away the money. Let's have some sense of pride. Let's take responsibility for our lives. Let's work collectively to improve the social condition that we live in. Let's stop projecting to others, whether we're projecting to the West, projecting to the state. When you look at the issue of young people and their behavior, it's nothing different from when we grew up. We always wanted to be cool, but there were consequences for breaking the rules. Now, there's no consequences. When they break the rules now, they get mollycoddled.
Absolutely.
When you bully someone at school, you
cool. You are cool.
To say you have a right to an education. Nobody talks about your irresponsible behavior and consequences.
Dr. Kgosi, I'm sorry, I'm going to have to leave it there. We've run out of time. It's been wonderful talking with you. Thank you indeed for your insights on this matter. I do hope to talk with you again in the future sometime. God bless.
Yes, thank you very much. Let each of us take responsibility for our own lives. Let's stop being victims. Let's make sure we respect the rights of others.
Absolutely. 8:31 exactly. News and views moving along. Stay with us. Lots more interesting conversations coming your way.